From the outset, I wish to publicly state that the outrage, the anger, the questions, the comments, expressions of disappointment and disgust by members of the public with what has been reported in the media regarding this Digital Vibes contract is well justified. It is the very same red flags that were highlighted by the Auditor General in December that made me request the Director General to not just hand over the investigation to the internal audit, but to urgently appoint a firm of investigators who would have the necessary capacity and independence to scrutinize all the documents related to the contract. Although the AG had raised the issues of possible overcharging by Digital Vibes, in my discussion with Director General, I suggested that we use the opportunity to interrogate the awarding of the contract, the changing of scope of NHI to COVID-19, and whether the department did receive value for money. The Director General proceeded as such, and the report that the department now sits with covers all those areas. I must also mention that the report also looked into the minister's role in these administrative processes and interviewed various officials in this regard. I wish to explain that we desisted from responding to various media queries due to the fact that there were two ongoing investigations dealing with various allegations that had been received regarding this contract. This was not intended to avoid ventilating the issues in the public space, but were advised to exercise prudence to protect the integrity of these investigations as documents and individuals were being interrogated through a formal and official process by the investigators. These investigations have been conducted by the Special Investigating Unit, SIU, that publicly announced earlier on the year that they were investigating these matters as per presidential proclamation regarding all COVID-19 allegations of corruption. The second investigation, the investigators, Ubane Tax Assurance Advisory Firm, were engaged by the department to look at matters that even predate COVID-19. The scope of the forensic investigation entailed the following: A, determining the method of procurement process followed in the appointment of the service provider, as well as the agreement entered into with the Department of Health and the service provider, and determine whether the agreement and prevailing legislative policy frameworks were adhered to. B, whether the acquisition processes, agreements, and spending were done in accordance with the applicable legislative policy requirements. C, identifying any irregular, unauthorized, and/or fruitless and wasteful expenditure incurred by the officials and associated accountability. D, investigate any other related discrepancies and irregularities identified during the course of the investigation, including but not limited to theft, fraud, and corruption. E, the forensic investigation must cover the work performed by Department of Health, government institutions, service providers, and subcontractors involved, and relevant industry specialists must be consulted when necessary. F, if there are indications that allegations identified may result in disciplinary, criminal, or civil action, this must immediately be reported to the project manager during the course of the forensic investigation in order to consider the necessary action. And G, to review invoices before they are processed for payment and advise if the Department of Health should consider suspending the services pending the outcome of the investigation. We understand that the work of the SIU is ongoing, and as was announced yesterday, the SIU head, Advocate Mkhize, advised the public that the investigation is nearing completion. As the department, we will continue to cooperate with this investigation, adhere to all their requests for information, and ensure that individuals whom they wish to interview are at their disposal. We will therefore be guided once its findings and outcomes are made available. With regards to the forensic investigation initiated by the department, I can confirm that the draft report was received by Director General on Friday last week. A final report has also been issued this week, Monday, 24th of May. Procedurally, once the Director General received the report, he had to ensure that the copy is also shared with the SIU. I, as Minister, also needed to ensure that a copy of the report is handed over to the President. This is because when this matter came up and my name was linked to it, I had a duty to report to the President, the head of the executive as my superior, and I had undertaken to keep him appraised. I can confirm that both SIU and the President were given the final report on Tuesday. I need to state that given the various actions that are already underway, we have been legally advised that we cannot fully disclose the details of the report at this stage and a plan of action that is already underway. This is because given the seriousness of the findings and intensity of the steps being undertaken, detailed public disclosure may jeopardize remedial action that is being undertaken. In summary, the investigation has found that the tender bidding process followed was in contravention of the Public Finance Management Act. The process of appointing Digital Vibes was irregular. Irregularity findings range from inconsistencies in the bid committees to lack of disclosure of conflict of interest. Secondly, the investigators have found that an amount of some 37 million paid to Digital Vibes constitute fruitless and wasteful expenditure. That in respect of COVID-19 related communications work that was performed by Digital Vibes, the investigators noted that the service provider received requests for work from Department of Health prior to the contract being expanded to include COVID-19 communication. These requests resulted in a financial commitment of some 35 million that the Department of Health ended up paying after the expansion was approved. Investigators therefore concluded that any amount which was paid to Digital Vibes for any work done in relation to COVID-19 communication prior to the approval of the expansion to include COVID-19 work was irregular, as the expenditure was incurred in contravention of Treasury regulations. The investigators therefore concluded that the appointment of Digital Vibes was irregular, and as a result, a total of 150 million that was paid to Digital Vibes by Department of Health during the period of 29 January 2020 to February 2021 was therefore irregular expenditure and should therefore be recorded in accordance with the stipulations of PFMA. I can confirm that the Director General has formally reported to the National Treasury as required. I can also confirm that the process of consequence management, that is taking disciplinary action against all implicated individuals, is also underway. Finally, I can also confirm that the legal processes to recover the funds that we believe the department should not have paid has also commenced. As I've already stated above, the details of this process will be disclosed at a later date in order to protect the integrity of these critical actions. We're aware that the question that may arise is whether elements of fraud and corruption were identified in the irregular expenditure. We wish to inform the public that this investigation is still ongoing through a flow of funds analysis that is being conducted. It is this flow of funds analysis that will also confirm that the department was overcharged for services provided by Digital Vibes and quantify it. I'm also aware that the key narrative that has been that this contract was awarded to my associates, and thus inferring that I may have used influence in the awarding of this contract to this said company. In our very first public response to this matter, I did confirm that Ms. Mita had worked in my office as a PA. She then tendered her resignation, citing personal reasons. In fact, the details of her resignation at the time were communicated to me by her direct supervisor, the Chief of Staff. She expressed that the work demands, including travel between Cape Town and Pretoria, as well as frequent traveling abroad, were taking a toll on her personal life, and she wished to focus on family and with time pursue a more stable job aligned to her qualifications and allowing her to be home daily. This was reasonable, and her resignation was accepted. At no point did she disclose that she was joining a company that had been awarded a contract by the department. There was never such a discussion with myself as the minister or any of the ministry officials. It was only after several months of that resignation that I was alerted by my office that Ms. Mitha was now working with the communications company. This came about as they reached out to my office to make an appointment to do various TV and radio recordings for the COVID-19 awareness campaign. In relation to Ms. Mather, I confirmed as early as February when this was asked by a journalist that indeed we had worked with Ms. Mather when I was in the Luthuli House as Treasurer General. The office was required to fulfill various public and stakeholder engagements, coordinate events and meetings. This was not extraordinary. All senior officials of the ANC are supported in such activities by Communications Office and support staff at Luthuli House. Therefore, I worked with many of these comrades at the time in the fulfillment of my role as TG. I must also clarify that when we contested ANC leadership positions for our national conference in 2017, I did not appoint a personal spokesperson. Many comrades offered their support in their individual capacity. But there was no one, including Ms. Mather, who was assigned as my personal spokesperson as it had been reported. I also do not regard any of these individuals whose names have been mentioned publicly as personal friends. But they are certainly my comrades. I have worked with them in the ordinary course of my political or official duties, and this is not unusual. As Minister, my obligation is to declare any conflict of interest when it arises, and in this instance, I had not identified any conflict of interest. I did not participate in the company's appointment process. I did not in any way influence the selection of employees or consultants of the company. Even at a departmental level, the minister is only informed once the whole procurement and administrative process has been concluded. As the executive authority, he is then notified and asked to approve the overall strategic implementation and program of action and its final financial implications. This only occurs after the administrative processes by the department, bidding and finance committee, confirming that the processes have been followed in line with all the legal prescripts, and confirmation of the budget is available and is being allocated. And lastly, the Director General, as the accounting officer, has also signed off on this. As our practice as ministers, we do not sign any submission that has not met these requirements. This therefore guards against and draws a clear line between administrative and procurement processes of the department and the role of the minister as the executive authority. In relation to both the NHI and COVID response, health is the department that is tasked with and responsible for the implementation of these strategic programs that have been resolved by Cabinet already. As early as 2019, there was a general concern in Cabinet that the messaging and education and communication to the public in relation to the NHI was weak. Government had not properly unpacked its purpose, benefits to the broader society, and concerns raised by various stakeholders had not been addressed. The department was then required to ensure that there's a proper strategic communication strategy. That is how far our interest as political office bearer will go, that there is implementation of such resolutions at an administrative level which complies with all legal requirements. Having said this, Section 217 of the Constitution is very clear It requires that when an organ of state contracts for goods and services, we must do so in accordance with the principles of fairness, equitability, transparency, competitiveness, and cost effectiveness. It therefore saddens me that we have now find ourselves in a situation where a contract that was supposed to fulfill public good has now violated constitutional principles that were meant to be always adhered to by the department. Excuse me. Personally, I must express my sense of shock at the figures that have now been disclosed in the report as constituting irregular, fruitless, and wasteful expenditure. There's also been a narrative in the media reports that ministry had outsourced its basic functions to a service provider, as the ministry programs are now alleged to have been coordinated by Digital Vibes. From what I'm told, this is based on invoices that the company submitted to the department. I have not had the benefit of seeing these invoices that were paid by the department, but I wish to categorically state that programs of the minister are coordinated directly by the office of the minister in the department. Members of the public will, for example, recall that when COVID-19 hit South Africa, this country subsequently went on a lockdown. I personally dealt directly with the provincial MECs. The ministry team was primarily responsible for the coordinating activities on the ground with those of the relevant provinces. Excuse me. All public addresses were prepared and drafted by myself and ministry officials. There are no speeches which were prepared by a service provider, and all core content was developed by the Department of Health officials. Given some of these specifics that have since come out in the media as work having been done by Digital Vibes on behalf of the department, I've asked the DG to avail copies of the said invoices to the ministry in order to carefully go through these items that were billed for and flagged, and all those that may have been included as having been done by a service provider when they were actually done by the officials internally. Whilst we have also accepted in terms of the investigation report that communications work was done, the analysis and quantification of the value for money is important. And in this regard, my position as minister remains clear and was immediately expressed to the DG on Friday when I had sight of the report. If there is evidence that funds belonging to the states were not used for the intended purpose, these must be recovered without any delay. In conclusion, therefore, I once again urge the media and members of the public to allow these processes to unfold. I acknowledge my responsibility as a public representative to account, and we therefore commit to keeping the public appraised to the extent that it does not compromise the ability of the investigating agents and law enforcement agencies to carry out their duties. If any member of the public has any further evidence that may assist these ongoing independent investigations, we encourage that these processes be supported. Thank you.